In an aging society, the role of care professions will become increasingly important. Therefore, the healthy and safe working conditions of nurses, medical assistants, or care home workers should become a particular concern. We and our loved ones will benefit from this now or in the future. Care workers across Europe struggle with various challenges like low wages, which lead to long working hours and multiple job holding. These are results of some structural issues present in hospital and care sectors, including underfinancing and understaffing. The problems were exacerbated by the COVID-19, when care workers stood at the forefront of the fight against the pandemic.
The HEROES project investigates health and safety policy and practices in 6 countries and the European sectoral level. In this study, we focus on the hospital sector and elderly care, because healthcare workers in these sectors are exposed to very similar occupational safety and health risks, but how health and safety law is implemented and enforced differs significantly between these sectors. Employers have a duty under health and safety law to take reasonable care of workers. The Occupational Safety and Health Directive also sets out rules and regulations that must be implemented at the workplace level. And social partners are involved in this process. So we are interested how trade unions and employers work together to implement this law and to protect health and safety at the workplace. We investigate countries such as Germany, Italy, Lithuania, Poland, Sweden and the UK. So this comparison is important because the industrial relation systems, they differ between countries, and also the actors involved at the different levels. Sectoral level, workplace level, they differ. We want to know how does this affect healthcare workers and how safe and healthy workplaces are in the hospital sector and elderly care sector. So this is the goal we investigate in this HEROES project.
The project encompasses 6 countries: Germany, Italy, Lithuania, Poland, Sweden and the UK, in which in-depth case studies were conducted focusing on care workers' health and safety. Also, an analysis of EU-level social dialogue has been conducted in order to better understand the regulative and institutional context in which care workers operate.
The study revealed that the challenges encountered by care occupations are surprisingly similar across Europe, regardless of the level of development of the healthcare sector or industrial relations systems. Healthcare workers face both the effects of structural problems, such as work overload due to staff shortages, and a range of sector-specific risks due to the nature of their professional tasks. These include, but are not limited to, exposure to biological agents, harmful drug substances, or sharp injuries. And what differentiates countries with more developed economies and social dialogue and those with lower levels of development is the degree of intensity of the problems mentioned.
You can read more about the main challenges for the care workers, the differences between countries in Europe, and the social dialogue's response to these challenges in the HEROES reports.